Welcome to another episode of the Life of a Healthcare CISO series. Today, I have with me Sanjeev Sah. Sanjeev is Vice President and Chief Information Security Officer at Centura Health. I'm really looking forward to learn a lot more about Sanjeev. I've known him for a number of years, but in his new role at Centura Health and the broad role that he has definitely makes me wonder what he's up to these days. So let's get to that. Good afternoon, Sanjeev. Thanks for being with us today. Thanks for your time.
Thank you for having me. Good afternoon. Excited about our conversation today.
So let's dive in. First of all, why don't you share a little bit about your personal journey? I know you have a very exciting journey that you have shared with me, but I'd like rest of the folks out there to hear about it. So tell me a little bit more about your personal journey from Nepal to the United States, as well as your career journey going from one of the largest manufacturing companies to healthcare.
Thank you. I definitely want to share a bit of a background. So I was born in Nepal and in a small village in the south of the country near a city called Janakpur. I have the fondest childhood memories of growing up in Nepal and have a deep sense of connection to my birthplace. My journey to United States began when my father, who worked as a scientist and administrator for Nepalese government agency that was focused on agricultural research, came to the US for his doctoral education. And I was about 15 years old at that time. And, I had a bit of a teenage growing up here, and much of my schooling was then in Michigan and around the country. And, my professional career really began with a junior IT level opportunity at an automotive firm out of Detroit, Michigan. And while I was there over a 10-year period, I had the most fascinating set of experiences. One, just learning about technology, seeing the use of technology in both corporate setting and manufacturing and operations, and how technology really supported business operations. And over a 10-year period, what happens is you get to see both the advancement and evolution of the technology and how it supports the business process. I learned a lot, working in this automotive organization, and ended my career there as a security. It really shaped my career overall. But I want to go ahead and pause there for a second, and I can tell you more about my other aspects of the career. But let me pause there for a second.
That's such a fascinating story, Sanjeev. How did you land in healthcare from the automotive and manufacturing world?
Yeah, so one of the advice that I received from my then executive vice president and chief information officer for this automotive firm was that I needed to, take what I had learned and broaden my perspective by taking my skills to new industries and then apply. But he thought, and the advice that I got was I was going to learn a lot more and have a bit more complete perspective that would really shape my professional outlook. And so with that in mind, I went to an organization in the south of the country, this time in Louisiana, at a home health and hospice organization. And that was my first time serving as Chief Information Security Officer for a healthcare organization. From there, I had an opportunity then to go to a higher education institution in North Carolina. And then, the bug had really stayed with me about the kind of mission, hospitals and healthcare organizations engage in, and took me to Texas Children's Hospital. And from there, I saw care at the utmost level, taking care of patients and providing the type of experiences. From my role perspective, again, I learned plenty, and I had opportunity to contribute in a very meaningful way, touching and impacting lives of others. And so I've been in healthcare since then, and most recently in my current role at Centura Health, serving as Vice President and Chief Information Security Officer. And as you know, this role is fascinating as it gives me opportunities to serve in other ways in our mission.
That's quite a journey. So, what are the other ways in which you're serving your mission at Centura? I'm interested in learning more about it.
Jimmy, I'll share this with you. You know, at one point, my own child went through emergency care. And what I felt and saw in an emergency room was that clinicians, doctors, nurses were fully dedicated and helping my child who was critically ill. What I saw as a tremendous opportunity was that maybe the technologies and tool sets at their disposal didn't really work in the manner that served them the best to take care of my own child. It really gave me a momentous indication that we needed to look at technology in healthcare in a way that came to serve patients, their outcomes, their experiences, by enabling our caregivers and staff the tools and technology in a seamless way where they could make best use of their talent and their time. And so, in addition to kind of learning that about my own child and her care, today in my role, even as CISO, application of security safeguards and controls are one, to protect the organization from cybersecurity threats, to give us the best defensible posture, but also as tools and technologies that enable efficiency. If you take a simple example of how clinicians are able to authenticate quickly and easily so that they have access to most important information when providing care, we keep that in mind as we're enabling technology solutions. Additionally, in my role today, I'm able to provide and lend support to mergers and acquisitions by performing the diligence aspect of what needs to happen in a mergers and acquisition cases. And that's, as you know, it's a fantastic opportunity to begin with. You are able to apply your business knowledge and your business sense in doing what's best for that relationship to occur. Additionally, Jimmy, I have this fantastic opportunity to work on many wonderful things. And one of the things that I'm afforded by my organization that I love and love doing, which is build up a new hospital. And we consider this new hospital a hospital of the future, where technology and innovation comes together in a way that does all of what I talked about earlier about my own child's care. Tools and technology to serve patients, their experience, by enabling our clinicians and caregivers with all of what they need to be most efficient in providing care.
As you were saying that, I was fascinated with how you narrated your core responsibility, which is protecting the patients and securing their information, right? And how you have sort of expanded that to overseeing due diligence for new acquisitions, right? And then as you build out new hospitals, how do you enable technology to be more viable for the patient, for patient care? And I'm sure as part of that, you're also applying the latest and greatest from a cyber threat management standpoint in a way that makes the patient experience better without compromising security. So it's really fascinating to hear how you're connecting the dots there. Wanted to pivot the conversation to the last question that I have, which is around the mission. And you mentioned the healthcare mission a couple of times in the conversation as sort of a key North Star that you had in sort of coming to healthcare, right? From manufacturing and something that keeps you going in healthcare. So You told me a few days ago that you are going on a trip to Nepal and a few other Asian countries on something related to the healthcare mission. And again, tell me, as a CISO, what is it that you're going to do around mission, and how does that sort of, help you complete that professional outlook that you are trying to constantly, I guess, enhance?
As I have grown older, learned a bit more in life, how we impact lives of others is really is the meaning of life. Centura provides wonderful opportunities then to engage in that effort. In our mission, connecting more communities to incredible care is at the heart of it, where we believe in providing the whole person care. So I have a personal mission, a statement, like all associates at Centura do. And so I'm on a mission to extend, elevate, and enhance care, outcomes, and experience for people we serve. That being my mission, through my work, through work that I'm able to do with my colleagues and my partners and team members and caregivers within the organization, then extends that opportunity even further. Centura has this global health initiative where we partner with hospitals around the world, including one in Nepal, to make that difference, where connecting more communities to incredible care is our mission. So I have this amazing opportunity to go back to Nepal, go to this hospital, and lend my talent, my support in any ways that I can to extend that incredible care on behalf of Centura Health, but also as my personal mission. So that's what that visit is all about. And I'm so thankful for the opportunity to be able to take part in that. As I mentioned earlier to your question about having come from Nepal, I still have that great sense of connection and responsibility to do all that I can. And this is that opportunity to serve.
Wow. This was an incredible conversation overall. A lot of exciting stuff, Sanjeev. Sounds like you're involved in a lot of very cool and exciting initiatives. A great model for other up and coming CISOs to emulate. Well, I truly appreciate you taking the time. Thanks for participating in our series and sharing your words of wisdom. Thank you, and take care.
Thank you, Jimmy.